Hi everyone, my name is Behnaz Sarrami. I'm pharmacist and medical science liaison at IDgenetix, where we support providers help their patients to get to the right medication faster. In this video, I will go over our sample PGX report called IDgenetix and simplify it for you. So when you're looking at our report, you can seamlessly go through it. We have a very comprehensive report that provides multiple meaningful genes. In previous legacy tests that may be outdated don't provide you with the amount of drug gene information that we have that comes from that's at the beginning, and then the drug interaction piece that comes after. PGX is a tool that guides therapy, and we must be mindful that there's a patient behind this raw data. So with that being said, I want to orient you and walk you through our IDgenetix report and how it's laid out. If you look on the left-hand side right here underneath the screen tab, you have these medications that either don't have a drug gene interaction or a drug-drug interaction. Versus on this side right here underneath this orange tab, you'll see the medications that have potentially a drug gene interaction or a drug-drug interaction. And the difference between the coloring scheme right here and the white boxes, you'll see if you were to select one of these medication for your patient, this would be what to be cautious of, versus the black just means the patient is actually on that medication. So for example, we have comprehensive report on this side, on the dosing side. If you take citalopram, for example, that the patient is on right now, it tells you the phenotype right here, which it says they're a CYP2C19 poor metabolizer. It tells you what to do with that information, whether consider a dose adjustment or an alternative medication, or if there's an indication to keep that medication on, to start with 50% reduced dosing, and also 20 milligrams per day maximum because of QT prolongation. So it gives you a comprehensive report and also tells you where the guidelines were from, CPIC guidelines. And that follows drug-drug interaction piece that you see down here. However, in this section, we don't provide comprehensive information as to what to do with that information, because there may be indication, although there's two medications that have a drug-drug interaction, but there is clinical indication that the patient can still be on both of them. So this is our mental health gene panel. You have the pharmacokinetic genes, all the CYP enzyme, and then you have the pharmacodynamic genes as well. And we also have the MTHFR. And we also give you information on Beer's criteria. So if I go back and look at the small number ones on some of these medications on here, that means those medications on Beer's criteria, basically a list of inappropriate medications for age over 65 because of either anticholinergic effect or risk for falls. So you have a comprehensive report which lets you decide which one applies to your patient. Of course, we have full clinical support to further help our providers with the individual test report for their patients. And as you get more familiar with our report, you can see the value of the information on there, and it will become second nature for you. So please reach out to us at alphiadx.com for more information and support.